Living with a skin condition can have a significant impact on quality of life and emotional well-being. Psychodermatology takes into account the connection between the skin and the mind, and particularly looks at the psychological impact. The British Skin Foundation want to raise awareness of this link and provide advice on what to do should you be affected. Dr Eleanor Chatburn, clinical psychologist, and Dr Mary Sommerlad, consultant dermatologist, both join me now. Thank you so much for joining me. Eleanor, first of all to you, can you explain what psychodermatology is?
Psychodermatology is a branch of medicine that integrates dermatology, so medical treatment of chronic skin conditions, with the study of brain mental health, so disciplines of psychology and psychiatry. Basically coming up with an integrated approach that thinks about what it's like to have a chronic skin condition and how that impacts your psychological well-being, your functioning, your whole quality of life. And we know that people with chronic skin conditions are at increased risk of developing mental health problems, understandably as a result of changes in their appearance, pain, the burden of managing a chronic skin condition. So psychodermatologists helping persons to think about all those connections and the mind, the brain and the skin all together.
And Mary, that's really interesting, isn't it? That link between skin and the mind. And it's really looking at the individual in a much more holistic way, isn't it?
Absolutely. We know that we cannot separate what's going on in our mind from our bodies, our physical experiences. And we know that there are specific biochemical triggers that can exacerbate skin conditions, especially if we think about inflammatory skin conditions. Things like acne and eczema can certainly be made much worse when we're feeling anxious or stressed. We actually release hormones like cortisol, which drive inflammation. So it's really important to understand that we are not isolated, our skin is not separated from our mental health and our well-being, and we need to view them as a whole in order to get the best outcomes for ourselves and our patients.
Eleanor, we've seen the demand for psychodermatology services increasing in the last few years. If someone is living with a skin condition, struggling with their emotional well-being, what tips do you have for them?
Oh, the first thing I always say to people is, if you're feeling distressed or upset about your skin, there's nothing wrong with you. It's understandable that you'd be distressed by having a chronic skin condition. So please don't feel that you're not trying hard enough. I think it really helps as a first step to find someone to talk to, someone who's going to understand and listen, whether that's a friend or family member. I particularly recommend talking to someone who has their own experience maybe of skin conditions. People just seem to have a different level of awareness, but also reaching out to patient support groups, charities, start looking at information online, which may also help you to consider, would you like to get some professional support for your psychological well-being?
And Mary, presumably with social media, there's also more increased impact as well. If somebody's got poor mental health, where should they go? Where do they find those resources?
First of all, I want to treat their skin disease. They need a diagnosis and they need a management plan. That management plan also needs to address the mental health problems. The good news is there are several resources of varying intensity. So usually if I see someone with a skin disease, I will ask them about the impact it is having on their day-to-day living. We can signpost patients to refer themselves to talking therapies free of charge and in their own time. As dermatologists, we can also refer patients for talking therapies. We can also refer to dedicated psychodermatology units, especially if they have complex mental health condition impacting their skin.
So, for example, if somebody's seen a dermatologist like you, they've been referred to a psychologist, what would they expect, do you think, out of their session?
I think the first thing is to look for a professional who helps you feel comfortable and at ease, because it could be the first time you come forward to talk about your emotional well-being and mental health. Then someone's going to be talking about the referral, maybe if a professional referred you, the reasons for that, but also exploring what is it that you would like help with. And then they'll help that person to think about a plan, make some recommendations, and give someone options so that they leave knowing what their options are.
And Mary, final question, what do you think the future holds for psychodermatology?
I think the future for psychodermatology is extremely exciting. It's also very, very important. Seeing someone as a whole, having a holistic, personalised approach is really crucial to successfully managing someone's skin condition as well as their mental health. I think the more research is done, the more we can understand what interventions can help people and that degree of intervention. So I think the future is very bright and promising and hopeful for anyone with an ongoing skin condition and mental health problems.
Dr. Mary Sommerlad, thank you very much, and Dr. Eleanor Chatburn, thank you both.
Thank you.